Hello friends, today we'll check out the difference between 24 and 25 modifier. Many coders have confusion in using 24 and 25 modifier since they are both ENM codes and they have very much similarity, but they are very much different from each other. So let us check out first what is the definition of these two modifier. So the definition of 24 is unrelated evaluation and management service by the same physician during the post-operative period. This post-operative period means the global period. It can be 0 days, it can be 10 or 90 days. So modifier 24 allows the physician to report a service performed during a post-operative period for a reason unrelated to the original procedure. The post-operative period for a major surgery defined as the surgery with 90 days follow-up period includes all routine care of the patient for surgery related services. So the post-operative period surgery of 90 days includes all the routine care of the patient of surgery related services. So mostly small services which are given during the 90 days global period are included if it is related to the surgery. But modifier 24 should be built with an ENM code only, and do not use this modifier with the CPT surgical code. So it is an ENM. This modifier should be used only with the ENM visit code. So this should not, modifier 24 should not be used with CPT surgical code. This is the most important thing the medical coder should understand, that it is an ENM visit code, ENM modifier. It should not be used with a surgical CPT code. Subsequent hospital care visit and critical care services by the surgeon during the same hospitalization as the surgery may be considered related to the surgery. Separate payment for such visit is not allowed even when billed with the 24 modifier unless for one of the following exceptions. So these subsequent hospital care or critical care visit given during the post-operative period in the hospital which is related to the surgery that are also not billed separately because it is included in the global period. So only few exceptions are there for in such cases when the critical care service is unrelated to the surgery for a seriously injured or burnt patient considered critically ill or injured and require constant physical attendance. So in such cases you can build those procedure with 24 modifier. Documentation attached to the claim demonstrates that the care being provided during the inpatient visit following surgery is not related to the surgery. So this is the important thing. Whatever services is given in the post-operative period, it should not be related to the surgery. Then only you can build those services with 24 modifier. It's very simple to understand. If a patient is there who has gone on to surgery and who has a global period of 90 days, so that surgery is a major surgery, so that can require many small services or follow-up during that 90 days. So to see the patient progress in those 90 days, so he may visit to the physician again and again to check what is the status of this condition after the surgery. So those visits may be related to the surgery and those are included in the global period. So those should not be billed within the global period. Those are included in the global. But if either after the surgery the patient has some other condition which are unrelated to the surgery, those services should be billed even if it is under global period, because those services are not having any relation with the initial surgery. So in such cases we have to build those procedure with 24 modifier. What I am telling about the ENM visit, whatever visit is happening in the global period which are unrelated to the initial surgery, you can code those ENM visit with 24 modifier. If it is related visit to the surgery, ENM visit, you cannot build them because it's already included in the global period, so it cannot be paid. So 25 modifier is significantly separately identifiable evaluation management service by the same physician on the same day of the procedure or other service. So modifier 25 is actually built when the process with a procedure which is done on the same day by the same physician. So this is actually a difference between 25 and 24. 25 is built with the procedure which is happened on same day. For 24 it can happen that service can happen before 20 days or 30 days, because those services will have global period, and then the ENM visit happen in 20-30 days, then we are appending 24 modifier based on the documentation. But in 25 the procedure is done on the same day. So modifier 25 indicates that on the day of procedure or service identified by the CPT was performed, the patient condition requires a significantly separate identified ENM service above and beyond the usual preoperative and postoperative care associated with the procedure that was performed. So it is done on the same day when the service is done, surgery is done, or some diagnostic exam is done, X-ray or MRI is done. So on that day 25 ENM visit will be done. So that in that case we have to use 25 modifier. The ENM service may be prompted by the symptom or condition for which the procedure or service was provided. As such, different diagnoses are not required for reporting of the ENM services on the same day. Assigning the proper ENM code as appropriate for service rendered. Documentation of usual circumstances may be submitted with the claim. So maybe those surgery or those whatever exams, diagnostic exam done on the same day with the ENM visit may have same diagnosis with the ENM code all in the same with the diagnostic procedure. So it doesn't matter, you can append 25 modifier to the ENM code, which will indicate that a separately identified ENM exam is done by the same physician on the same day of procedure or the service. So we'll see how we can find out when we should apply 24 or 25 modifier with some scenarios. So for 24, this example is this. See, if someone procedure is done with the CPT code 58145 on 1st of November for diagnosis D250, which is a leiomyoma of uterus, and again after 1 month it is coming back with an ENM visit, and that ENM visit code is 99213. So suppose, and the CPT code 58145 has 90 days global period. So ENM visit has been done within global period. So the ENM visit 99213 is done under global, and it is, hence if it is related to code 58145, it's get included in it because it cannot be paid, because major surgeries, after major surgery many follow-up will done to see the patient progress. So in such cases this ENM visit, if it's related, it gets included, or if it is otherwise not related, you can append 24 modifier with the given ENM code 99213 for unrelated ENM visit within global period. And diagnosis, here diagnosis should be differ, because the diagnosis should be different. So here for CPT code 58145, suppose diagnosis related to uterus, and for ENM visit he is coming for some vaginitis. So in such cases we have to quote this 99213 with 25 to get it paid from the payer for the service provided in the global period. So 25 is denoting that this visit is done for an unrelated diagnosis which is done within the global period of CPT code 58145. Another exam is same. So CPT code 727446 was arthroplasty knee exam. First it is done on left side on 1st of January. Then ENM visit is done again on 20th of January for right side diagnosis. So in such cases one is done on left and the ENM visit is done for some right side diagnosis. So CPT code 27446 has a global period of 90 days. Any ENM visit fall under 90 days global period because it is done just after 20 days. So it will fall under within global period. Now the diagnosis is, suppose for 27446 is done for left leg fracture, and for ENM visit he is coming again for some right leg injury. So the totally different side. First is done on left leg and second is on right leg. So diagnosis is different. So that is ENM visit is done for unrelated diagnosis. So we will append 24 modifier to 99213 to get it paid from pay. So these two examples are for 24 modifier. For 25, if you see in ENM, you have here used, see when any diagnostic procedure is done along with ENM visit on same day, that procedure has S or T status modifier. So here if you can see in the image, I have highlighted the status S modifier with radiological X-ray chest single view. So if such exam is done along with an ENM visit code, you have to give that ENM visit code 25 modifier. If this status is having T modifier, then also you can give 25 modifier to the ENM visit code. So then we can assign 25 modifier to ENM visit code for same day. This applies only to codes with 0 to 10 days global period. See, the procedure which is having S and T modifier should have a global period of 0 or 10 days, because those are minor surgery or minor procedure. But if the procedure with like it is having 90 days global period, then you cannot use 25 modifier, because then you have to use 57 modifier for the major surgery procedure with ENM code. So note that the modifier 20 is only required on the procedure code with the final status indicator SOT is reported on the same cell, which is shown in here in the image. With S modifier, I have not added modifier 25 to this 99233, but you have to add 99233 25 modifier when there is an S or T status modifier. So if the procedure or surgical code build of 90 days global period with ENM visit, we have to use 57 modifier. So if with this ENM visit code we have a surgical code which is having 90 days global period, you have to use 57 modifier instead of 25, because 25 is used only for the minor procedure like diagnostic exam, minor procedure which is having 0 days global period. So here for 90 days global period surgical CPT code, we have to use 57 modifier with ENM visit code. This modifier is not used to report ENM service that is resulted in a decision to perform major surgery. So 25 is not used for the major surgery, 57 is used for major surgery and when for with ENM visit code. So this is the only difference, 25 for minor surgery or minor procedures, 57 for major surgery or major procedure with 90 days global period. So this way you can find out using 3M that where to use 25 modifier with ENM visit code. Hope you have cleared your doubt regarding 24 and 25 modifier. If you really like the video, do like it and share it, and do also give some comment regarding this video, and please subscribe to my channel so that I can bring more videos related to medical coding in this channel. Thank you again.